bummer, because really, if people came to functional medicine first, I think it would save them a lot of time and money, and probably get them better faster. And for those people that can't, those are the people that absolutely need to see a specialist for sure.
And welcome to Healthy Living. I'm Dr. Don Pelto, and I have Lisa Vasile here. She is a practitioner of functional medicine. Thank you, Lisa, for joining us.
Thank you for having me. I'm excited to be here.
So we're going to talk a little bit about functional medicine, and I really want you just to kind of tell me your story, how you kind of heard about functional medicine, how you got involved in treating patients that way, and why you're so passionate about it.
So it's a long story short, I have been a nurse practitioner for 15 years and a nurse for 30. And throughout my nursing journey, I had multiple patients coming in and out, especially as an NP, that were sicker and sicker, or more uncomfortable, or bigger and bigger, but more and more medication. So less quality of life, but more medication. And I just kept thinking there's got to be a reason why. Personally, I had been diagnosed at 37 with celiac, and that whole revelation of take a food group out that really you can live without pretty easily, and get rid of extreme fatigue, brain fog, IBS, horrible anemia, because of a food group. And I was like, wait a second, I've been in nursing and nurse practitioner forever. Why is this something that's always like the last thing checked instead of one of the first thing checked? Because I had been complaining, of course, for 20 years. So then I had an experience with my mom, who had no medical issues. My sister was diagnosed as well. We diagnosed my mom, but she was older. And unfortunately, one of the side effects of undiagnosed celiac, and of course, the things that come with that, are poor nutrition, et cetera. It can actually, that TTG, which is the tissue transglutamase, that's an antibody, can actually attack the brain. So she had a vicious, very fast dementia that she went from being super healthy, strong, no medication, 6 feet tall, regal, beautiful, in a wheelchair as a vegetable, and passed away within 3 or 4 years at 5 years old. So it was kind of a wake-up call of, okay, we need to figure out what else we can do for our family, but then also what can I do for my patients that are coming in with all of these complaints and they don't feel well. Or they have all of these tests done and everything's normal. So here's a pill for that symptom. And so why these symptoms keep happening? So it really sort of, put me from the straight and narrow traditional model to keeping one foot in that model, because I have such respect for that. And what else can we do to put more in the toolbox? Some of those things might be looking for why somebody's getting headaches, or looking for why they have heartburn or bloating or constipation, instead of just a deficiency in Miralax.
Yeah, so you were used to the traditional method of treating patients. Were you seeing more just internal medicine type of patients?
I was at the time I've done both, a lot of women's health, labor and delivery, and I was working in a GYN office at that time. So a lot of patients would come in for their yearly pap smear, and they would be telling me about their high blood pressure, of course, part of our exam, right, or our conversation, restless leg, inability to poop. They have terrible issues with constipation. And so I would be like thinking, well, that sounds a lot like what magnesium, all of those things are magnesium. Go ahead and try some magnesium, making sure, of course, that their kidney function is fine. And they would take a little bit of that, and they would come back maybe a month or two later. I'd say, come back in, let's talk about it. And they'd be like, I have way less this, way less that. What else do you have for me? So I really sort of, getting the integrative background, which we don't get a lot of in traditional medicine. There's not a lot with nutrients and food. It's more eat less, exercise more, don't have salt, and those kind of things that may or may not be totally appropriate for every single person.
And then did you feel it necessary? Did you just kind of experiment and self-learn? Did you take courses on this?
Oh yeah, many courses, forever. So years of functional medicine courses, integrative health and nutrition courses through the Institute of Integrative Nutrition, Institute for Functional Medicine, and the School of Applied Functional Medicine. And so throughout that journey, I was also able to work in a functional medicine and a primary care office, a medicine office. And then I opened my own practice about 5.5 years ago.
Wow. And just explain, tell me this, what it's like, how you're practicing for the last 5 years and what it was like 30 years ago in terms of your patients, how you're able to help them, maybe share a couple of patient stories and things like that.
Sure. So, I was working more in GYN, as I said, when I was working as a nurse practitioner, and prior to that was a nurse. So, not a lot of examinations and stuff like that. So, as an NP, if we talk about the last 15 years, it would be the patient comes in, and I still do the same thing. You listen to the story, you find out what their complaint is, try this treatment, whether it be an over-the-counter treatment or a medication, and if that doesn't work, come back.
Mm-hmm.
There may be some lab work entailed, and there certainly, if possible, an exam that might go with that, right? So if it doesn't work, come back, and then we'll try something else. If it doesn't work, come back, try something else. And what I'm doing now, which is a little bit different, is instead of the person coming in saying, I have a headache, or in GYN, I have recurrent yeast infection, say, I would say, well, what else might be causing that, to upregulate the body's immune response to make this
Mm-hmm.
happen? So specific to headaches, is it a nutrient deficiency? Is it, dehydration? What is their stress level like? Are they sleeping? Do they need chiropractic care in their neck or their back? Or are they walking funny, which is making everything else crazy? That would be for you. And then, or the yeast infection, it could be what they're eating, could be that they have something going on in their gut. And so it's just a lot more time to be able to investigate sort of their journey through what brings them there. And they may have no idea that something that happened to them 4 years ago might be what's causing this today. And so it's a real story of what brings you today. Let's see what else is going on. I'll have people come in because they have eczema, and I'll go through their story and be like, this, and what, and they've just gotten used to those things. They might complain about we have a form that they check off, and they'll say, geez, I got so used to having headaches or fatigue that it's just kind of who I am. And there's a lot of that, right? So even within our community, friends, relatives, even practitioners will say, well, it's just part of getting older.
Interesting. And in terms of how much, let's just talk about in terms of your patients, just by giving them supplementation, changing their diet, stress relief type of techniques, is that the majority of how you're able to help them, and just because you're spending more time?
Correct. Yes.
Yeah.
There just is not enough focus or emphasis. And unfortunately, the last 10 months of our lives, this is a huge, it's really in our face that unfortunately, those that have less resilience, those that were coming into the war, unfortunately, with maybe more metabolic syndrome, maybe issues with medications, those that were not as healthy, unfortunately, are finding it harder to be resilient against these viruses, right? These things that come after us. And so when we're looking at traditional medicine, it's the focus of right now, they don't have time. You got to understand, they're very, very busy. And so they don't have time, and they may not have the resources, but the focus is take the pill for the ill, and very little conversation, partly because there's a little defensiveness when it comes to the person, right?
Yeah.
About, maybe what you're doing every day on a regular basis, day after day, cumulatively, is part of what's going on. Reversing that is not easy. Taking a pill is much easier.
Yeah. And I think going back to how you treated then and now, maybe, I don't know about you, but we have 10, 15 minutes with a patient. You can't really cover that much. It's easier to give a pill in 15 minutes, but you don't have the luxury, but you take the time now to spend maybe a half hour or an hour or whatever they need.
Correct. Well, so our first initial patient is an hour and a half to 2 hour visit. And I mean, nobody has that time.
No one.
Right.
No one. What a privilege. What a privilege.
Right.
Wow. Okay. Well, for those that are listening, that's exciting. And so we're going to get into a little bit more about kind of what's exciting you now in terms of how you're helping your patients now. What excites you?
So I get the pleasure of getting a little bit more in depth. I look at it's a puzzle piecing, and it's an onion peeling. So one thing that we ask patients to understand is that coming in, we need a lot of time to kind of look through the whole story, piecemeal, maybe do a little bit of testing, maybe do trial and error with different lifestyle choices, lifestyle changes, whether it be medications, because we still prescribe supplementation, could be even do some acupuncture or see a podiatrist, what else is going on in your body that's adding burden. So looking at what's burdening the body, whether that be crappy food or a lot of stress or malalignment or what's out of balance in the body, and trying to really sort of fix those. It cannot be done in 1 month. It cannot be done usually in 3 months, right? So people are coming to us, they've been sick for 2 or 3 years and maybe 30. And so you can get them there, but I usually will say, are you willing to do this for the 6 to 12 months that it might take your body to kind of remember how to be healthy again and get back to that balance baseline? And it's an onion. You peel something, you're getting better, and all of a sudden it's one step back. Okay, what else is going on? Oh, look at that. Now we have to fix that. It's rebuilding that body back to balance, back to baseline.
Wow. That must be so pleasing for you to see patients actually getting better, because all we deal with probably is like we deal with chronic issues, and they just
Right.
they're not, and most people are just kind of, I'm going to be diabetic forever. There's nothing.
Well, and so that's a huge, thank you so much for saying that. I'm so sorry to interrupt you, but there are a lot of people now, of course, obviously type 1 diabetics are type 1 diabetics. Don't get me, let's not go there, but type 2 diabetes, pre-diabetes, insulin resistance, metabolic syndrome, the big belly, we have fatty liver, whether that's alcoholic, mostly not now, it's more non-alcoholic fatty liver from what we're eating and our lifestyle. So we 100% have people come in and say, an autoimmune is an autoimmune, you'll have it forever. Diabetes, you'll have it forever. High blood pressure, high cholesterol. And we really can reverse those if the person is consistent for the long haul, right? This isn't like a diet. This is a lifestyle change. If you do it and you do it consistently, your body will slowly get back to where you don't need some of this, or maybe you still need it, but way less dosing or way less number. So a metabolic syndrome patient, which is diabetic, obese, usually has high blood pressure and high cholesterol, they may only need to be treating the cholesterol or may only be treating the blood pressure instead of those other things as well. I've had people that have come to us that have been constipated for 30 years. They might go to the bathroom once a week or maybe every other week or twice a week. And within 6 months, they're going every single day with no bloating or discomfort at all, no medication.
That's awesome. I want to delve into this diabetes because a lot of people listening to us are probably dealing. Why don't you share a story of a patient that came in, maybe they had an elevated A1C, maybe they had an amputation, maybe an ulcer, that's what I see, and then how you were able to reverse the diabetes and just kind of walk through what's that process. It's probably not a 3-month process. It's probably a long process, right. But what was needed? You're kind of preaching to the choir here. We want to simplify it. Is it like low carb? Is it intermittent fasting? Is it a combination? Is it diet? What is it?
I think that's a great question. I noticed that you have quite a few intermittent fasting interviews. So that's great. I will say there's not one answer to that question. I think it depends on socioeconomic group because people, depending upon what people can afford, what their ethnicity is and what they might react to or not react to, depends on how stable they are, both emotionally and physically, right? So especially something like intermittent fasting, if you're not stable physically and emotionally, that could actually make it worse, right? So let's pick one really cool. I have an amazing patient who came to us, 36 years old, pretty healthy looking guy, fairly active, worked out, went to the gym a couple times a week, lifted. He had 3 little kids. He had low platelets forever, and he had sky high liver enzymes in fatty liver forever. It was familial. So his triglycerides were in the 300-400s, and he had been on medication. He came to us for hives. None of those other things. He came to us for hives and wanted to figure out what was going on. So we started looking because we know that disease begins in the gut. And we started looking at what was going on. And in doing so, I did lab work. His hemoglobin A1C was 6.2, and he had never, ever been diagnosed with a pre-diabetic diabetes before. Mm-hmm. His blood sugar was, I think his fasting blood sugar was like 125, which isn't too high. But his insulin, which is the fasting insulin, which many people don't get tested, that fasting insulin was about 29. His GGT, which is also liver and sugar mediated, was also high, which is looking at fatty liver. And in the process of what we did with him, we did 100% a grain-free diet.
Okay.
And we went no dairy, and we added supplements to try to lower some of the inflammation. And we also did stool testing, and we found that he had H. pylori. So we took away the H. pylori with some supplementation and medication. And over the course of 6 months, it was about 6 months, his platelets for the first time normalized in about 15 years. His platelets are up in the 140s instead of 99, 100. They should be like 130 to 250 is a good range. And then all of his liver markers went down, and he was completely off of his fibrophenate, his medication for the triglycerides, and only on supplementation. His
Wow.
A1C went down to 5.2. He lost about 15 pounds. He was a small guy to begin with, and he had the energy. And guess what? His hives went away.
Oh, by the way, his hives went away. Yeah. It's amazing what you can do with food. It's amazing.
Well, and it's amazing how inflammatory food can be, right? So not for everybody, it's not the same story for everybody, but a lot of the food, unfortunately, the nickname of standard American diet is a sad diet, is that there's just loaded with a lot of crappy oils, that omega-6 that's so inflammatory, high fructose corn syrup, or even just sweeteners of some kind, the dextrins and the oses, and a lot of dyes. And they're just not, you can't read the ingredients and understand what the food is. So if you even just removed processed food and didn't eat maybe a paleo or a whole food or a grain-free diet, even just knowing what it was and cooking your food, that
whole food,
nutrient dense whole food.
Okay, the crux. What works best in your opinion for habit change to get people to do that? You can't tell me, Lisa, just Don, do that. How do you help people make change? How does change happen?
That's a very good question. I think one of the advantages that we have in our practice is that people are frustrated, they're sick and tired of being sick and tired, or they're really scared. And so that's a pretty good motivator. If you've got somebody with severe rheumatoid arthritis and they're looking at, they're already on 3 medications, and some of them are chemotherapy medication, and now they're looking at IV therapy, and they've got, fingers that are deformed, it's really motivating to them. Or you've got XYZ in your family and you're really trying to avoid that. I would say the biggest thing would be to just right out look at them and say, what does your life look like if you don't make this change? And what does your life look like if you do? Let's look at both of those lives and see where you're able to meet me in the middle. If you're not willing to do a full grain-free diet or Whole30 diet, or even intermittent fasting, any of those things you mentioned.
Yeah, I think those are great tips. We have about 10 minutes left here. You had some things you're going to share with us, so we're going to kind of bust through these. And these are for people. We're talking about immune, in terms of what are 5 immune supporting actions or supplements that people can do.
Nutrient density 100% of the way. So that can come from, answer your supplement. Some people will do like a whole food supplement, not meaning the store, meaning when you look at it at the label, it says carrots and beets and broccoli and things that are food. Because if you can't get 8 to 10, because the statistic is only, most people are, I think adults, I think the statistic is 1.2 or 1.8 vegetables per day, when we're supposed to have 4 to 5, and optimal is 8 to 10. So I say eat the rainbow. If you can put it in a smoothie, if you can put it in a soup, if you need to put it in a whole food supplement that you're taking, that would be great. Nutrient dense, try to do that. Take away anything sugary and sodary. That includes all those frappity, frap, macchiato, da.
None of that.
The high fructose corn syrup is killing us for 100% of the time. It's causing metabolic dysfunction, hormone dysfunction, weight gain. We're looking at moving. People don't think of that as an immune support. They think of it more as I need to lose weight support, but it's 100% immune mediated. And those that don't actually upregulates the cytokine or that fight. So we need to make sure that we're working with that. And only about, I think it's like less than 5% of adults are moving more than 30 minutes a day.
Wow.
And then sleep and stress reduction. So sleep and stress reduction are huge, especially in today's world in the last 10 months. I think people are so hyper-focused on the fear and the isolation and what they can and can't do. And all of that is really wrecking sleep. And both of those things are hurting our immune system. So shut off the TV, anything that's toxic, whether it be a person or a TV or social media. Don't go there. You got to do the happy. You've got to look at ways to stress reduce. And those can be even things like acupuncture, Reiki, or Qigong, or yoga at home, or whatever it might be, meditation.
Those are great.
And then if you can't sleep, talk to somebody about ways to sleep, because you got to get that sleep.
Yes, sleep is key for everything, for weight loss, for reduced inflammation,
Mhm.
everything. Well, switching now, what are 5 tips for reducing inflammation? Inflammation is we call in podiatry, equinus is the root of all evil, or tight calf. So, but for you, I'm sure inflammation
It's the
is the root
same.
of
It's
all
the
evil.
it's the root cause of all disease is inflammation. If you can relate with that, I would say looking at all of the things that we just talked about, for sure. That body balance and body burden. What kind of things can you do to remove? Even things like I said, like all of us are sitting in these arenas. You're standing, which is good for you. I can tell you're standing. That's awesome. So having that ability to get up and walk around, to get some chiropractic movement, because all of us have tech neck now, and we have issues with knees and back because of what's going on. So that's a huge one, but also make sure you're looking at the gut. So like I said, I would, it's something like 70% of people in the world have some form of gut dysfunction, and that might be burping or bloating or heartburn or gas or uh, even constipation, diarrhea, or all of the above. And if we don't fix that, your immune system is right beyond the gut. You're going to have an upregulated attack, so to speak, in the body, and you won't feel well. And then looking at toxic exposures is a big one. So what are we doing that you can control in your house? Things like, what are you cooking with and on? What kind of things are you cleaning with? And what are you putting on your body to clean with?
Okay.
Things like plastic shower curtains, oils, things that you can control in your own household, that by reducing that burden, the immune system isn't quite as distracted or exhausted.
Interesting. Those are, I wouldn't have thought of that last one. That's great. That's great.
Yeah.
And then we mentioned about, in terms of, if someone, let's say they don't have the opportunity, they don't have the privilege to see you, Lisa. We'll talk later if they want to learn more about you, how they can learn. But let's say they have their own doctor, and they feel maybe inspired, or they want to learn more or do other types of tests. Are there some other things that they should ask their doctor to order, and why will they do it? Won't they do that? And what are some of those labs?
First of all, my dream is to get this kind of medicine dripping into traditional medicine. So, and it can be done in a very like little teeny bits. And so that's a really good question as far as how can we get people a little bit more inspired and empowered, so to speak. So most docs will do a CBC, which is a complete blood count, and they'll also do a BMP, which is a basic metabolic panel. It would be okay for you to say, doc, especially if you've got something going on of anything, whether it be symptomatology or medications for something, excuse me, I would say a CMP, which is a complete metabolic panel, is a little bit more comprehensive for both liver and for kidney. A good example is I just had a diabetic work with me. He came to me again for other things, and we're trying to work on his diabetes as well. And he had his labs come back, and his glomerular filtration rate, which is a kidney function lab, GFR, should be over 60 to be normal. I tested it and it was 58 because I did a CMP. His labs prior to that had only been BNP, basic. So in BNP, it only says over 60. It doesn't give you a number. So you don't have any ability as the patient and the consumer to track your labs. And I would say, before we go into what labs we should do, are you aware of what your lab data is? And are you tracking that and trending that? Because so many people get the letter in the mail that says, everything's normal, keep doing what you're doing, see you next year. Or your blood sugar is a little bit high. We recommend that you test it again in 6 months, eat less sugar, lose some weight. But they don't know what that number looks like. And all of a sudden they're diabetic, but their fasting blood sugar might have been 78 10 years ago, then 82, then 88, and then 92, then 96, and 99. And not until it's 119.20 are they going to be called abnormal. So if you start seeing trending, you go to your doc and say, what's going on? So along the same line would be asking for a fasting insulin. Because if it's over 10, we prefer under 8, but if it's double digits, and traditional medicine says it's okay if it gets up to 20, which is way too high, then you're having issues with insulin resistance, and that can increase the risk of inflammation everywhere, including the brain, dementia, and of course diabetes. And then that A1C that you mentioned, that hemoglobin A1C, you can ask for those even if you don't have diabetes. If you have a family history, if you have metabolic syndrome, if you're overweight, definitely. A couple others would be nutrients. A lot of people may get a D level or an iron level,
Mhm.
but actually asking for the whole iron panel, which would include a ferritin, which is your iron stores. If it's really low, then you're not, then what's going on there? If it's really high, then that's a sign of inflammation. So that's a really good test. And then things like D and B12, as long as you're stopping your supplements for 4 or 5 days before you go, so that you're not testing the supplement, you're testing you. And then lastly, if you have a diagnosis of like high cholesterol or thyroid, I usually say ask for a deeper, thorough testing. So for cholesterol, I might say there's a cardio IQ test that is paid for if the ICD-10 codes are proper, by insurance, especially if you're treating it. And then the other would be thyroid, getting a full thyroid panel instead of just that TSH.
Yeah.
And along that whole inflammation, there's 2 tests that people can ask for that are very helpful. Something called a CRP, which is a C-reactive protein, and a homocysteine. And again, some of those you said, would they do them if someone asked? It depends on the doc, and it depends on what the person is walking in there with and what their prior personal history is or family history, and what their goals are with their practitioner. But these can be ordered by themselves. Massachusetts is one of those states. It's only 5 in the country that can't. But Massachusetts, you can order your own labs through UltaLab, ultalab.com. And then you could kind of just at least, and it's not super affordable. It's like, for those tests I just mentioned, you might spend $150.
Oh, it's not expensive at all.
Yeah.
And if you have a high deductible plan, you're paying for that anyway. So
correct. So like for me, that's a good example. My husband and I have a $1,500 per year deductible. And if they were to do the labs at our regular doc, it would be kind of half of what I want. And it would cost me about $800. We order my own. It's a lot more comprehensive, and it's only about $300. And then at least I'll never hit my deductible. So it doesn't matter.
yeah, that's great. Lisa, I think we covered a lot today for people. Let's say if someone wants to learn more about you or your practice, where would they go to find that? Is there a place online or a number they could call?
Yes. So our practice is called the number 4 Better Health. So it's a number 4 betterhealthmedicine.com. That's our website. It's 4 Better Health is our company, and it's myself, a physician, and our admin. We also have Instagram, which is the number 4 Better Health.
Okay.
And then we have Facebook as well.
Great. You were very, very helpful. I can see the passion, and I thank you for your time on the show today.
I can't thank you enough for having me, and I hope that everybody learned something.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.